Unless you're following medical news closely, the chances are you could be harbouring some misunderstandings about what it means to live a cardio-friendly lifestyle, and as a result you might have fallen into some habits that are doing your heart more harm than good, maybe even increasing your risk of cardiovascular disease. While it's true that heart disease is more common among people over the age of 65, about 10% of heart problems occur in people under the age of 45. Your daily choices play a role in your heart health. Spending your days moulded to the living room couch and eating foods with poor nutritional value, high in sugar, trans and saturated fat, can lead to accumulated plaque in the blood vessels, significantly increasing your risk of future heart problems regardless of your age. Another factor that can increase your heart disease risk in the younger population is type 2 diabetes, and this is becoming more prevalent in children, teens, and young adults. The main takeaway is it's never too early to be proactive about your heart health. If you've experienced a cardiovascular event, it's understandable that you're hesitant about engaging in physical activity. Running a marathon or spending hours at the gym after you've had a heart attack isn't the best idea, but having regular exercise offers many heart benefits. Research suggests engaging in regular full-body movement strengthens the heart, it improves blood flow and delivery. And what's more, a 2020 study that was published in the European Heart Journal revealed the chance of exercising triggering a cardiovascular event is extremely low. Plus, having a regular sweat session is also terrific for your brain and your whole body health. If you feel fine, you probably have normal blood pressure. This is a huge and common myth. There's a reason that high blood pressure is called a silent killer. You can have high blood pressure without even knowing it. That's because hypertension can develop slowly over time due to different causes like diet, genetics, or a sedentary lifestyle. Monitoring your blood pressure and making lifestyle changes when needed can help you to reduce your risk of heart disease. Chest pain is a main sign of a heart attack. This is another myth that's been busted. Experiencing intense chest pain, shortness of breath, and pain extending to the left hand, specifically the ring and the pinky finger, is often thought to be a sign of a myocardial infarction or a heart attack. Unfortunately, over 60% of people who have a heart attack don't have any of these symptoms, making it a silent myocardial infarction. Having enough good cholesterol can offset bad cholesterol. Your body uses cholesterol to make hormones, vitamin D, and to build cell membranes. However, having too much low-density lipoprotein in your blood can increase the risk of coronary artery disease and other heart problems because it can lead to a buildup of cholesterol in your arteries. And no, you can't offset the effects of high LDL by raising your HDL. Building a sustainable habit and regular eating heart-healthy foods is the best way to help your body to maintain a healthy HDL to LDL ratio. The blanket statement, fats are bad for your heart, is a myth. While it's true that some fats aren't the best, fish oil like omega-3, EPA and DHA does wonders for the heart. That's because they offer monounsaturated and polyunsaturated fatty acids, and these have been shown to be good for cardiovascular health. You'll find these healthy fats in a variety of food, like extra virgin olive oil, nuts, seeds, fatty fish like salmon, tuna, and mackerel. It's true that having an occasional glass of red wine throughout the week can have heart-protecting properties. The resveratrol found in the drink also makes it heart-friendly. Before you pour another glass, keep in mind moderation is the key. Heavy drinking is linked to several health risks, including heart disease. Some people believe that any amount of red meat is bad for you because it can affect your cholesterol levels. This is a myth. It's true that your diet impacts your health, but you don't have to swear off red meat to keep your heart healthy. The secret is to eat lean, unprocessed red meat in moderation, along with an overall healthy diet. Having a family history of heart disease means you're at a higher risk of developing heart problems, but it's not set in stone. You can always take steps to reduce the risk and to stay heart healthy. You can also experience heart disease without a family history, which is why leading a healthy life is imperative for your heart health. Whether you're cruising through your 20s or living your best life in your 60s, maintaining a healthy heart is essential for a long, fulfilling life. Finding a physical activity that you enjoy and perform consistently is the key to helping to reduce the risk of heart disease. Whether it's swimming, Pilates, or running, making time for body movements at least 5 days a week for 30 minutes a day will help you to strengthen your heart muscle and to improve blood flow, reducing the risk of heart disease. Incorporating nutrient-dense, antioxidant-rich foods into your meals is a great way to maintain heart health. An easy way to achieve this is by following the Mediterranean diet, and this includes fish, plenty of leafy greens and vegetables, fruits, whole grains, and healthy unsaturated fats. Unmanaged stress levels have been linked to cardiovascular events. That's why working on your Zen is a vital part of staying heart, mind, and body healthy. Adding meditation to your daily habits, getting restful sleep, and staying active will help you to have a healthy response to stress. Annual checkups, especially as you age, can shed light on any health concerns that might be affecting your heart. In addition to eating heart-healthy foods, complement your nutrition choices with nutrients that support heart health, like fatty acids like omega-3s and omega-7s, CoQ10, vitamin D and vitamin K, magnesium and probiotics. That's because your body uses these nutrients to regulate and to maintain many biological processes that are associated with a healthy heart. Over 6 million Americans suffer from congestive heart failure. This is according to the Center for Disease and Prevention. And this condition, in which the heart muscle is so weak that it struggles to pump blood through the body, is something that you can help to prevent with a heart-healthy diet and lifestyle. Unfortunately, there's 2 nutrients that can offer additional support for a strong heart muscle. Studies have shown certain nutrients can help to strengthen your heart with fewer side effects than the drugs typically used to treat chronic heart failure. CoQ10 certainly stands out. The goal with nutrients is the same as with traditional drugs, to strengthen the heart muscle contractions and to improve blood flow throughout the body. In chronic heart failure, the heart muscle progressively becomes weaker because it enlarges in a process known as cardiac remodeling. This process is the primary culprit behind the reduced quality of life with chronic heart failure. The chest pain, shortness of breath, and other symptoms that can affect the quality of life. You can fight back against cardiac remodeling with CoQ10 as a key player. It's been studied in this capacity since the 60s, and it continues to show promise in helping people with chronic heart failure. There's ample evidence that the CoQ10 is a powerful chronic heart failure foe. A review of several small CoQ10 studies between 1966 and 2005 found an overall improvement in the percentage of blood pumped out of the heart when people took this nutrient. Several clinical trials, including more than 1,000 patients with chronic heart failure, indicate that those who took the CoQ10 had improved exercise tolerance, plus their chronic heart failure was rated as less severe due to the nutrient. A study of 27 patients with the most severe classification of chronic heart failure had improved heart function and fewer symptoms after taking the CoQ10. A study on 420 patients with heart failure found CoQ10 intake led to improved symptoms and it reduced the major adverse cardiovascular events. There's 2 commercially available forms of CoQ10, ubiquinone and ubiquinol. The ubiquinol form is better absorbed by the system than ubiquinone, so you might want to opt for that form. The optimal CoQ10 dose depends on your blood levels, so it's important to get a lab test to find out how much you need. Your heart needs energy to keep your blood flowing and every organ functioning, and that's why D-ribose, a nutrient that's found in every living being, is so important. Several studies of chronic heart failure patients who took D-ribose have shown improvements in blood flow and other symptoms. Plus, in a study of healthy athletes, supplying fatigued muscle cells with D-ribose quickly restored the cellular energy to normal levels. If you want to optimize your heart's energy levels, D-ribose could be right for you. For more information on heart health or more information about herbs, supplements, and natural treatment plans, check out my website.